Right, super. Well, firstly, thank you for joining today. Really appreciate you taking the time out of your day to join our webinar. I know some of you will be kind of listening to this post the session, which we will be recording today, and we will be making it available to all those that registered. And also post this event as well. Really pleased today to be joined by our panel, who are listed on your screen in front of you, I hope. And today we're going to be giving you some thoughts and insights into building capacity in children's social care, and a few different kind of aspects from the organisations that are represented on our panel. I think from our perspective, Bloom, we will be kind of talking a little bit about kind of what Bloom do throughout the webinar, but delighted to be joined by some of our supplier marketplace to talk specifically about kind of what they do too. And we're going to kind of work through some kind of questions. We'll give a bit of an introduction as well to each of us. And we're happy to take questions which you can post as you go. So please feel free to drop those into the Q&A. I'll do my very best to kind of pick those up and make sure that we answer them as we go. Anything that we can't answer, we'll of course make sure that we're able to share that after this webinar. So firstly, I'm going to go through some introductions. I'm firstly going to hand over to Mike Farron.
Thanks, Paul. Good afternoon, everyone. My name is Mike Farron. I'm a commercial manager within Bloom Procurement Services. So my role is very much around helping customers and clients build projects through specifications and outcome-based models, and dealing then with the supplier side of things. So linking both customer and supplier side in order to get a project underway with Bloom. Thank you.
Thank you, Mike. And hand over to Steve.
Good afternoon, my name's Steve Woodhead. I work for People2. People2 as an organisation are supporting across local government and health in the design and implementation of outcome-focused services. As an organisation, we operate not only in the social care arena and not only in children's, but we operate across the whole of local authorities, from property and facilities management, passenger transport, and obviously in adult social care and children's services. My background and my specialism is around children's services, and as an organisation, we hope to work with people rather than go in and implement something without the organisation. Thank you.
Brilliant, thank you, Steve. And Sophie?
Thanks, Paul. So I'm Sophie Fowler. I'm the Director of Public Sector Recruitment, Eden Brown Synergy. Eden Brown Synergy are a public sector recruitment specialist with a number of core markets. Two of our largest markets are qualified social work and social care senior interims. Personally, I spent the last 7 years working in partnership with a number of local authorities in the supply of both temporary and permanent social workers and senior managers.
Fantastic, thanks, Sophie. Richard.
Afternoon, I'm Richard Parkinson from Farpoint. Farpoint's an independent technology consultancy. We provide advice to public bodies on how to deploy and use digital connectivity and digital public services. In the health and care sector, what that means is that we work with councils, housing associations, and devolved government to help them plan how technology-enabled care can be used to improve services and service efficiency. And we also work alongside organisations, helping them through the process of making technology change. So when you've got your suppliers and IT teams coming to you talking about DPIAs and cybersecurity and IP addressing and all this other great stuff, we sit alongside you as a technical friend, try and bridge the gap between IT and social care to make sure that these services that are deployed are fit for purpose and that the projects are a success.
Brilliant. Thank you, Richard. And actually, I'm not sure if Sarah has managed to get onto the call just yet, but she will soon shout if she has. But I'm going to say no. So I will move on from there. And when Sarah hopefully is able to join us, then she'll be able to introduce herself. So as you've heard from those on the panel, we've got quite a broad range of skills and experience here. So please, do feel free, as I say, to ask some questions as we go, to kind of have, if there's specific things that are things that you're working on right now and some of the challenges that you have, then actually we're happy to have a discussion about that. So what we're going to do, I'm going to ask a few questions of the panel. Happy to take questions as we go, but actually there will be a session at the end, which will be a short Q&A if that's required. The reason that we kind of set this session up actually is that we're very conscious that public sector organisations are under increasing pressure to manage increasing demand in social care, and local authorities have got to create a service that's fit for purpose under a backdrop of a number of different challenges. There's some really kind of interesting articles out there about kind of skills gaps in this space, some of the challenges that local authorities in particular are facing over the next few years. And there was some interesting statistics around 40% of councils in England are not confident they'll have enough social workers to meet demand, significant issues in recruitment and retention, and also emerging skills gap. So actually finding experienced social workers was actually a real challenge. And actually what this is doing is creating a need for external support to actually meet that growing demand for services. And for us, this is about kind of requiring the public sector to think more innovatively about how to meet this increased demand. So I think, there's some, as I say, some people on the panel today who are very familiar with that and have some really interesting thoughts about what that means. And for Bloom as an organisation as well, actually, we have worked in not just social care, but kind of other areas of the public sector where actually these challenges have been very clear, and we've helped organisations to resolve those issues. So I hope that you enjoy the session today. I'm going to hand over first actually to Steve, and Steve's just going to give us a little bit of an insight into what challenges he is currently finding and people too are finding with the clients in meeting kind of capacity in the system right now.
Thanks, Paul. And Paul's obviously cited quite a few of the challenges there in the opening address, but when you think of this question, the first thing that always comes up when we're working with clients is that it's the financial issues that actually people are saying we don't have enough money, and the fear of not having enough money in the future as well. And when you set that in the context of there being, wherever we're going across the country now, we look at data, statistics across the country, across all local authorities that we go into, there's higher demand for services. So it's increased demand. Again, we see that's been exacerbated through COVID as well, because the changes around the demand has come in, but there's also an increased complexity to the demand that's coming forward. When we look around a lot of the work we do around disabled children, we start to see that there's complexity in some of the needs of those children that is outstripping what it's been before. And these are all things that people are trying to deal with. And with complexity comes additional expense and the way in which people have to address that expense. The other things that we're seeing when we're looking at social care services as well is that when we don't just look at the service, because when we move in, we have to look beyond that. But we're seeing that money is being taken out of the areas that prop up those services, that support those services at earlier stages, preventative measures, early help measures. And I think we've got a discussion around that today at some point, because that's really important that we bolster that in some way. And another key area we've been looking at is placements, where people are trying to achieve placements across the board in all different ways, that actually we're very much, the public sector appear to be or feel that they're at the mercy of providers because not managing that market properly and not shaping that market properly. So I actually find that they're competing with each other to get the few placements that are available near to home that are appropriate for the children and young people that we're working with. I'll stop there for the moment and see if that.
Yeah, and I mean, I think you picked up some really good points there, Steve, just around, this kind of idea of kind of early intervention and prevention, which I think has been around for a long time, but actually has become all the more prevalent at the moment. And clearly where, I talked about skills gaps, that's something that I suppose isn't going to go away, and it's not going to go away quickly. What sort of interactions have you had where you've been talking with local authorities? What sort of interactions have you had around kind of helping to meet some of those gaps?
So moving on a bit more into solutions there, is that okay, Paul?
A little, yeah. I just thought it was a natural segue, Steve.
It is, absolutely. And I think we've found that we've had to look more than anything else. It's at where people are working together and where people aren't working together, that they start to fall down and start to not be able to manage that level of support. So integrating services at the earliest stage possible around a young person, around the way in which you deliver services. So services supporting each other rather than competing, as I said before. One thing that we quite often look at is that when we go into an area, and I'll use the area that I live within just because that's easy, but if I went into Calderdale, I'd be saying, let's look at the Calderdale pound rather than looking at Calderdale Social Services, Calderdale Health Services, Calderdale Early Support Services, actually bringing that public finance together and thinking about it as one. You can start to make a lot better use of it, but that involves a lot of trust, a lot of building, working together, and starting to move towards those hazy days of maybe even pooled funding and joint commissioning, which is something that we've certainly done in parts of the work we've done in other parts of the country.
And actually, picking up on some of the detail then around kind of integrating services. What are some of those challenges, where you're talking about kind of health and social care and how that kind of integrates and that kind of the local pound that you talked about there? What are some of the biggest challenges you've found with that kind of integration?
I think there's a lot comes down to culture and the way in which people are, the culture that's been formed and the trust that's within the culture, but also it's the way in which we carry data to first and foremost, to actually be able to start from that very basic understanding of information, sharing of information. So when we've actually found something, when we understand something from a young person, from a family, can we share that and how can we share it? Because the young person has told the establishment once, the family have told the establishment once, they want that to be then used and used wisely and safely. Now we can do that and we have all the safeguards in place to be able to do that through the mechanisms, but quite often it's the fact that we don't apply those and we're fearful of still taking that step towards sharing something to then support the person. But I think it's like in any safeguarding situation, if it's been, safeguarding top trumps everything, doesn't it? But I'd like to see that come further down, because you can share information if it's safeguarding a young person. But actually, if you take that down to early help and thinking, well, that's actually safeguarding that young person within the system at an earlier stage, then yes, we should be sharing that information and sharing it wisely, but obviously not breaking any of the rules under GDPR, but actually making them work for us.
Absolutely, yes, and thanks, Steve. I think that's really helpful to kind of frame that and give some insight into some of the solutions. I'm going to just hand over to Mike, who's going to talk a little bit about kind of some of the work that Bloom have done in this space. So Mike, over to you.
Thanks, Paul. Yeah, so my background is total public sector until I came to Bloom. So the last 10 years of that was dealing with issues on procurement around children's services, public health and adult social care. So a lot of procurement was seen as a blocker for getting people in, to getting the service carried out for the service user, whether it be a child or an adult. So what Bloom are trying to do is open that up, is make that as less bureaucratic as possible by just trying to be more open, more flexible in the way we approach projects and with suppliers. So we're looking at, and what Steve touched on there was around the local pounds, the localism. So it's very much around if there's a charitable organisation or if there's a not-for-profit organisation that you really would like to work with, then we can actually register those suppliers within 2 or 3 days, work with them, help them with bid writing and things like that, and trying to just bring together the customer and the supplier in order to get the right solution in place for the service user. What we're seeing is a lot of the projects are around reduction, so reducing existing figures or reducing caseloads, but also increasing figures, so increasing things like it's safeguarding, it's in the quality of life of someone, their independence. So we try and build milestones around those, and within those milestones we can pay a percentage if they can evidence that the work's being carried out. So we don't have to wait until that milestone's actually being completed over time and 100% completed. We can actually pay them monthly, quarterly, however you want to build that within your structure as a customer. And also from a supplier point of view, let us know how you want to work and how you want to go through that, the progression really of that project. So yeah, it's very much around building in what the customer needs and their requirements, what the supplier can actually deliver capacity-wise and quality-wise over the duration of the project, but also around looking at the social value elements and bringing in more localism if required. So it could be just a sole trader who is on the high street who does a brilliant piece of work around training or safeguarding, and we can manage that, or it could be a multi-million-pound diagnostic review of a whole career, whole children's services pathway. So again, we're ultra flexible and we will consider all specifications, and obviously we've got people to help moving that forward.
And I think a really important point actually that you mentioned there, Mike, was around collaboration. So I think actually, you know, Steve, you touched on it about that being kind of key to resolving some of these challenges. And actually, Mike and the wider team have done a huge amount of work where actually we are looking at how we collaborate. So actually the local pound has been mentioned, but actually, you know, local health services with the local authority and how they work together, and trying to overcome some of the challenges that Steve outlined before. I'm going to just hand over to Sophie, and Sophie's just going to give a little bit of a view about some of the solutions that Eden Brown Synergy have offered, and kind of a slightly different take, I think, on some of the things that we've just talked about.
Thanks, Paul. So as I mentioned earlier, Eden Brown Synergy are very much coming from the supply side. So working in social work recruitment for a number of years, everyone's talking at the moment about COVID-19 and how that's affected the supply, the recruitment and the retention of social workers. But in reality, that's been a challenge since I started 7 years ago. The challenge is to recruit social workers, retain them and continually upskill them. We do work with managed services across the country, but and we supply social workers via those managed services. But what we have identified in the past 2 years is that actually working more closely and in partnership with local authorities to understand their challenges and find a solution that meets what they're looking for, rather than, I suppose, telling them what they need. One area we've looked at is the recruitment, but more importantly, the retention side. It's a social workers market. There's lots of jobs out there, and actually the successful side of teams that we've placed has been our peripatetic teams, and they are fully rewarded on retention. So we only bring on the most experienced social workers, and they on completion they receive a retention bonus for completing the project. But more importantly, within those projects, one thing we have looked at is around the development. I think it was mentioned earlier. It's not just that COVID-19 will increase when schools open the number of referrals, but actually the challenges that frontline social workers are being faced with now are very different than they were 5 years ago. So we supply, and I think all suppliers of social workers are responsible for this. We supply the continuous personal development to those social workers to better equip them to face those challenges. Another area that we've supported with more recently is there is an increase in children on CP plans. There is this huge increase in the numbers of looked after children. And actually, on the back of a relationship and understanding on authority, we offered a team around reunification. And you could talk around cost savings all day long, but actually it was more about quality. And when we focused on, when the team we put in place, which is headed up with people like Sarah, who are experts in social care, we managed to take on 130 cases. And of those 130 cases, 90% of children were returned back to families. So there was a focus on quality and better outcome for children. And I think from a supply side, if all suppliers are able to start looking at it as social services does, which is focusing around better outcomes for children, you effectively get better results.
And I think that's a really important point, actually. And Mike also alluded to this around, the measurement of outcomes, and actually not just those being about kind of numbers, but actually things like quality of life, like, finding ways of getting children back with their parents and that sort of thing, I think is really important. And actually that's something that is really key to kind of what we deliver at Bloom, and I think obviously aligns very closely to what Eden Brown Synergy are doing, kind of with these kind of notion of teams that are going in to support specific interventions, which I think is really, really positive. I just want to move on a little bit. I'm going to bring Richard in now to just talk a little bit more about sort of the digital side, actually thinking about what digital solutions are available to help ease some of these pressures on capacity within the system.
Yeah, fine. Just before I start talking about digital solutions, my son's online trumpet lesson has just started just as you asked that question behind me. So apologies if there's a bit of background noise. Technology-enabled care is an area that's moving on very fast, and obviously there's been quite a lot of focus on it over the last few years. So there's a lot of solutions on the market, and there's a lot of solutions coming onto the market all the time. So I won't try and cover them all off by any stretch, but it may be worth just mentioning a few areas in particular where I think that there's potential for technology to help create capacity in children's social care. I would say that the three areas we would highlight would be around technology helping social care staff work more efficiently, helping staff connect more effectively with service users, and in helping deliver preventative care. And Steve's already mentioned that from a kind of an early intervention perspective as well. A couple of those areas have moved on pretty rapidly over the last year as a result of COVID. I hesitate to say that it's something that's good that come out of COVID, but we really have seen a lot of technology change on the back of COVID. So obviously we're all using remote working technology a lot more than we were a year ago, and that means that social care staff and other staff are now a lot better set up to access systems remotely and to work on a range of devices when they're working from home and out and about in the community. But that hasn't been applied consistently, and I think we all know that there's still quite a bit of paper that's out there. So there's still more that can be done to use that technology more effectively, and to move things online to help better sharing of data between agencies and things like that. I guess the good news is that there's a lot of social care systems are being moved into the cloud. So that does open up a lot more options for that information to be accessed on a range of devices more easily, and also to be shared between agencies a lot in a lot more straightforward manner than was possible before. I think the other technologies area that's moved on quite a lot over the last year has been around the use of video technology to connect social workers with service users, and a lot of that has been focused not on having to go out and buy solutions. It's been focused on a lot of the consumer apps, people using WhatsApp and Zoom and FaceTime and the like for video calling and voice calling. I mean, I've not seen too many scientific studies done on this yet, but certainly anecdotally, the feedback that I've seen from social workers and from service users is that they've taken to this technology really well, and that it's worked well during lockdown. So I guess, you know, the objective now is as COVID eases, fingers crossed, COVID starts to ease over the next few months, that we really kind of retain the use of these technologies and try and build on the work that's been done over the last year to grow and expand the use of these kind of technologies, because they do offer a lot of potential to both improve the efficiency of services, but it's not just about efficiency, it's also about helping to improve services. And we had seen some of these services, the types of technologies been used in services before COVID. We have seen examples of social care providers using video tablets in place of some overnight sleepover arrangements for some service users where that works for them, where they would provide them with a tablet and just have them make a video call to a carer if there's any sort of support needs during the night. So that kind of technology can work in certain cases. The other area I mentioned was around using technology in preventative care. Obviously, as Steve's already mentioned, this is around kind of trying to use technology to identify issues as they emerge, to hopefully either prevent or delay care needs starting to escalate. And we've seen a lot of focus on this in the work that we've done in adult social services as well. So I guess one thing I would highlight is that there is opportunity to start sharing some technology solutions between children's and adult social services that maybe there hasn't been the case kind of before some of this digital technology became available. So you can use this technology to check in regularly with service users, to check on their well-being, to provide support and advice, to monitor conditions, etc. And again, this could be used to replace some face-to-face sessions that happen at the moment, but it could also be used to provide some forms of support that you can't do at the moment. And an example of that is some of these technologies give you a lot of flexibility in how calls are routed. So you've got a lot of flexibility in how and when calls are made and from where. So what that enables you to do potentially is to set up specialist teams, maybe specialist teams that are shared between care providers, that can focus on providing very specific forms of support. You know, again, looking at a specific care need or a health condition. And again, we've already worked on this in some of the work that we're doing around adult social services, where we're looking to help set up specialist teams that can provide kind of mental health support and support around health conditions like COPD and diabetes and things like that. I'll maybe stop there, Paul. I know I've kind of skimmed across the surface of a few topics there, but hopefully demonstrated kind of some of the opportunities from these technologies.
They're really helpful, Richard. Just something that did cross my mind, and this is probably work that we do as an organisation across other kind of categories, is around the kind of infrastructure that underpins some of this, the technology. Has that presented any issues, or have you had any challenges where you've worked with organisations that simply aren't geared up to benefit from this sort of technology?
Yes. There have been some challenges. I mean, as soon as you start talking about digital solutions, digital services, I mean, clearly to deliver those, you need both your social workers and your service users to have access to devices and some kind of internet connectivity to do it. And in some parts of the UK, that is still not a given. So yes, that has been a consideration. And again, we've seen in some cases organisations providing service users with devices and internet connections in order to get them on this, because yes, there's a cost associated with providing that device, but equally there are advantages from both a service point of view and a cost point of view that you can get from allowing them access to the services in that way.
Great. I really appreciate that, Richard. Thank you. And I think to kind of wrap up before we kind of move on to Q&A, I just wanted to just get a quick overview, I think, from the panel really about kind of what they would recommend around kind of the next steps that people can take to consider how we approach increasing system capacity. So a hand over to you, Steve, first, if you kind of just can give your sort of thoughts on that.
Okay, thanks, Paul. I think first and foremost, understand the context in which you're operating. Whenever we go into an organisation, the first thing we have to understand is the context, from the data, from the talking to people, to actually see where everything is lining up and what's working, what's not, and look at where the spend's going. So actually, if the spend is all in acute services, then do we need to rebalance that, and in which case need to invest to save, not take it out of the acute services, but invest it somewhere else in the early help services to then allow the spend eventually to come out of the acute services. Clearly, I think I've stated my passion for early support. The earlier you can get support in, that's in the life of a child, but also at the onset of an issue, a problem for a young person, a child, a family, then get it in and make sure it's relevant, and make sure through all this that you hear the voice of the child. At every stage of the process, we need to hear that coming through, because often they know the way in which they need to be responded to. And I think the final thing from us is the way in which we work, and we will always try to develop the work, is that we want to leave a legacy. So we start working as a team with the people in the organisation we're working with. We don't go in and implant something. We want to work with the people to build that strength and ability to take it the next stage. So invest and in whole family working as well.
Great, thank you, Steve. Appreciate that. And Sophie, over to you next for your kind of closing thoughts.
I suppose I really mirror that. I think my experience on the supply side in social work, with the recruitment of social workers over the last 7 years is, and like I said, it's difficult to take positives out of COVID, but we've definitely worked more closely with clients. I think the ability for us to understand their challenges and really understand whether it is an outcome-based solution that they need, so short-term intervention, or if it's a longer-term solution focused around how do you retain social workers, and how can we support with implementing training programs, etc., to upskill the current social workers you've got, is really, really important. So I suppose my advice to any local authority would be look at who is supplying on the social work side, and build some relationships with them, two-way relationships, and work as in a sort of more partnership working, because everyone wants the same, which is the best outcome for children, and to make sure that social workers are sourced, the good social workers are upskilled, and they retain in those roles. Brilliant.
Thanks, Sophie. And I think the relationships piece is crucial at every stage. Everybody that's talked today, I think, has talked about those relationships and how they develop and how they are integral to the future, the social care. Richard, I'll just pass back to you briefly. I mean, in terms of from a technology point of view, but your kind of views about steps to take.
I'm actually going to echo Steve as well. So, I mean, slightly surprisingly, as coming at this from a techie, my advice would be don't focus on the technology. need to come at this from the direction of the service need and service user, and the technology is a supporting tool, not, it shouldn't be leading this. And don't forget about the operational change that needs to be put in place to make technology change a success. It's often that stuff that kind of means that this stuff either works or doesn't. And the other bit of advice would just be not to try and kind of overcomplicate technology change. There's always a temptation to kind of try and do some massive technology project that's kind of health and social care integration and all this stuff. There's a lot of technology available now. It's a lot of technology that's available off the shelf, consumer technology that's available and can deliver some real benefits. So you've got some real opportunities for some quick wins off of that kind of technology as well. But it's good to have a longer term plan as well. Kind of start small, think big.
Brilliant. Thank you, Richard. And just before I hand over to Mike for some final thoughts, if anyone has any questions, they could drop them into the Q&A now. And obviously we will take questions kind of after the session. Anyone can get in touch. Mike, just final thoughts from you.
Yeah, I'm actually looking forward to what the outcomes are from the independent review of social care children's services. That was, I think, green paper sent out in January time. So I'm hoping that obviously helps and opens up a lot of potential opportunities for people to work better, more collaboratively, but also pinpoint where the barriers are, but also what the solutions are to overcome those barriers. So, I mean, that's hopefully key. And what Steve said before, that it's very much around the voice of the child is heard throughout the process and throughout the pathway. So, and again, what Sophie said, it's about retention and recruitment. A child wants to see the same person week in, week out. They don't want to be jumping around between social workers and those relationships going. So think things like that, which would help Sophie and whoever else who's recruiting social workers, have them in place for a number of years. It's bound to be a big plus. But finally, from a purely personal point of view, the procurement angle, so the transforming public procurement document, that green paper, that could do a lot to help with the social care elements. Now, there's obviously a light touch regime and things like that through public contract regulations 2015, but we can expand on those. We can make them even easier to get the actual niche clients and suppliers on board and get those working a lot more flexibly than what the current regulations allow. So yeah, things like that from a purely geeky technical procurement angle, I think we could make things a lot easier for both customers and suppliers.
Thank you, Mike, and absolutely, I can relate to that. What you were saying, but look, I think what we've heard today, I think, is a lot about kind of understanding what challenges you have right now, understanding what relationships you've got both internally, externally, and the staff you have in place, and really interestingly kind of thinking about technology as that kind of supporting function, putting the child at the heart of everything that you do as an organization. I think just a kind of final word from me, really, just to thank the panel for their support today. It's been really interesting, really insightful. As I said before, very happy to take any questions after this session. You can submit those via the website. We've not got any questions to answer directly now, so we will of course be in touch after this session and share any wider information with you. But again, thanks very much to the panel. Thanks very much for attending today's webinar. We really appreciate you taking the time out of your day to get involved. So thanks very much, and look forward to hearing from you soon. Thank you.
Thanks, Paul.